Before we get into what an NFPE is, I'm first going to talk about the basics, reviewing the main importance, then the 4 techniques associated, and then signs and symptoms that you can use to better diagnose the patient. So before anything, we'll talk about what the complete nutrition assessment is. So we have the medical record review, followed by anthropometric measurements, diet and nutrition intake, interview, and then lastly, the final examination. So mainly, we're going to be talking about what the physical exam is. But before doing anything with the physical exam, you first need to do a medical record review. And the primary purpose of this is to foster quality and continuity of care for all patients. And basically, it's a chronological account that creates a means of communication between the providers and members for preventative health treatments and services. The documentation aids doctors in making decisions about patients' medical care. And the NFPE can confirm or identify muscle wasting, edema, subcutaneous fat loss, and then can use this to clarify information along with the physical exam with the medical record review. So these are just different things that the medical record review utilizes. So we have age and developmental appropriateness, changes in nutrition intake, GI symptoms, and then as you can see, the anthropometric measurements, we have height or length if younger than 2 years, and then head circumference if younger than 3 years. And this is because this changes with pediatric and adult patients. In pediatrics, we're looking more at if they're in the growth and development phase, and that so much isn't necessary in adults. The physical exam begins with the general inspection of the body and skin, moving from the head downwards to the feet. And there's 4 techniques involved: inspection, where you're observing, you're hearing, smelling, and what you're seeing. Then auscultation, listening, primarily probably using a stethoscope or a naked ear, and this is to listen to sounds produced by different parts of the body. Percussion, you're tapping, use your fingertips to tap lightly against the body structures to assess the location and density of the underlying body masses or the organs. Lastly, palpation is touch, and you're using touch to evaluate texture, size, location, temperature, warmth, and mobility. Aspen notes that the physical examination component of the nutrition assessment is more critical in pediatric patients, and this is because pediatric patients can become more malnourished more quickly than adults, and this prolonged malnutrition can negatively affect the growth and development in the long run. So this is just a list of tools used for the NFPA, and as you can see, there's a ton of different ones. However, the tools used may depend on either the practice of that specific clinician or the patient population. So like most popular ones are skin fold calipers, bioelectrical impedance analysis, or even like the reflex hammer. So skin. The 2 techniques we're using is inspection and palpation, and you are inspecting like color and uniform appearance, thickness, symmetry, hygiene, and palpate for moisture, temperature, texture, mobility, and then this can all be used to diagnose like dehydration, edema, and infection. And the skin should feel cool to warm to touch, as well as being smooth, soft, and even. Next is head, where we have inspection and palpation. You're looking at the eyes, and here you can see like this is what hyperthyroidism and Bitot spots looks like. So technique, inspection, palpation, eyes, nutrient deficiencies like vitamin A and riboflavin, and palpate the patient's hair, looking to see if it's smooth and symmetric. And again, other diagnoses could be hypothyroidism, dehydration, and protein deficiency. The mouth, using inspection, inspecting the tongue to see color, surface of lips, corners of mouth, mucus, gums, and then you're determining if there's any pain when the patient swallows or chews. And then possible diagnoses could be dehydration, riboflavin, anemia, vitamin C deficiency, and B12 deficiency. And the neck. We're inspecting to see if there's any obvious abnormalities, such as a mass or visible thyroid tissue that moves upward when the patient swallows. And diagnoses could be iodine deficiency, which looks like an enlarged thyroid, and then there could also be a local infection. Lastly, the abdomen. We're looking at inspecting for symmetry, contour, texture, and color using all 4 techniques. And as you can see, each kind of section of the abdomen can be used to diagnose a different deficiency or condition. There are 6 F's that they call it for abdominal distension. So fluid, fat, flatulence, fetus, feces, and full-size tumor.
Hi, my name is Kayla Osberg, and I'll be talking about the importance of nutrition-focused physical exams. Nutritional and health professionals need to get a better physical snapshot of their patient's health that goes beyond just the patient's height and weight. This will provide more knowledge on the patient's overall health and may help pinpoint specific illnesses that nutrition can prevent. As Abby had stated, malnutrition can be identified in many areas of the body and may be revealed in loss of appetite, pigment change, a distended abdominal region, edema, or muscle wasting. Looking at all these clues can help provide the best individualized nutrition intervention. Height and weight measurements are commonly utilized in healthcare settings and used by dietitians because it allows them to calculate body mass index, create an appropriate meal plan, monitor the effectiveness of the nutritional intervention, track changes in the patient's weight, and is usually required to fulfill regulatory requirements of the facility. However, only looking at the height and weight of a patient to evaluate their nutritional status can have many limitations. The limitations might include inaccurate measurements of short-term weight change if you're relying on a client to recall their weight change in the last few months. Also, short-term weight gain or loss could be due to fluids and not nutritional status. Finally, by just looking at changes in the weight does not determine if the weight difference is due to fluids, change in lean body mass, or fat mass. Older adults might commonly notice a significant weight loss, which could be due to loss of lean body mass, which is not desired. Nutrition-focused physical exams are particularly important to be implemented in long-term health facilities. This will help to improve the quality of life for all the patients. NFPA allows dietitians to conduct a more comprehensive assessment, which can lead to more efficient and effective nutritional care plan. If patients are there for a while, changes in their body composition due to loss of fat or muscle wasting should be noted and monitored every so often. This could identify more nutritional issues that would have otherwise gone unnoticed. Physical exams are also very important in kids because they can become more malnourished more quickly than adults. Prolonged malnutrition can affect their growth and development. In developing countries, it's commonly seen in cases of micronutrient deficiency, essential fatty acid deficiency, and protein-calorie malnutrition. However, these physical exams are not usually conducted in pediatric facilities due to the lack of training or knowledge on specific kid information. However, Tanner will talk about more of the challenges.
Hi, my name is Tanner Graves, and like my partners before me, I'm going to be talking about the nutritional focused physical examinations and the challenges that follow. So with a nutritional focused physical examination, there's a head-to-toe examination that physically assesses and identifies signs and symptoms that will show malnutrition or deficiencies in the macronutrients or micronutrients. With that being said, the challenge is knowing how to find it and what to find. So some physical challenges that are seen, or like we said before with Abby, is going to be one in the hair. So this spot's going to be able to show you identify either hair loss or brittle hair, miscolored hair. If that's the case, you have to be able to identify between a nutrition or non-nutrient based problem. So for example, things like alopecia, cancer, so with chemotherapy, or even things like baldness from when you grow older. These are things that are non-nutrient based and are going to happen throughout time. Some other things are going to be like things like in the skin, which is going to be having to differentiate between dermatitis. So either it's going to be from a nutritional deficiency or it's going to be from other cases or other problems or conditions. So it's good to assess a medical team to figure that out. In addition to that, there's also going to be the eyes, which is knowing the stage of the xeroplathemia and finding the deficiency. So is it with the eyes, like you said before, we have the bumps, we have the redness. So is that just a vitamin A deficiency, or is it protein and zinc as well, which help bring vitamin A from the liver? In addition to that, we have the oral cavity. So the oral signs are going to be either signs of nutrient or non-nutrient based conditions once again. And finally with the nails, once again, there's going to be signs and symptoms that are going to either show nutritional or non-nutritional based problems. So it's just a challenge of having to differentiate between those two. In addition to that, we have the physical challenges that are continued. So as we said before, the abdomen is another one that's going to be super important with distension, pain, all that different kind of stuff. A lot of that is due to nutrition and food, whether it's gas, distension, fluid, constipation, or all those other things. It can also be muscle soreness and pain in general, or like a hernia. So knowing the difference between a nutritional or non-nutritional problem is kind of the challenge here again. And same with the extremities, we have, looking at the skin for scalp, we have the redness, we have the scaly skin, all these different things, edema. And once again, it's just going to be looking at whether it's a nutrient or non-nutrient based problem. And with some other problems that we have that aren't so much the physical examination, are going to be malnutrition in the hospital. So some statistics for you guys would be estimated that 1 in 3 patients admitted to the hospital are actually malnourished in the United States, and only 3% of them leave with a diagnosis of malnutrition. So it's kind of a problem, not getting to see whether they're malnourished, where they're malnourished, and what cause of that is. In addition, we have physical touch. We have Michelle Martha, who's an RDN, and an NFPE trainer, explains that physical hand-to-hand contact with RDs is very uncomfortable for them. A lot of RDs come into the job thinking they won't have to touch patients or be in a physical area or have to touch them physically in that interaction. So having the education and being able to identify that and be okay with that is one of the biggest things too. And also this examination helps with things when certain labs or even things like anthropometrics really can't cut it. So it's really nice to see, like for example, albumin and prealbumin is affected by inflammation and fluid. It used to be a way to see if it was malnourished or not, and now they don't use these things because they can be affected negatively by the inflammation and fluid content of the body. In addition, some other problems that happen are with RDs not knowing, which is things like scope of practice. Like I said before, many RDs don't realize that physical exams are within their scope of practice, so it's a huge problem for them not either knowing or have been taught or even just exactly feel comfortable giving these examinations. But they're super important in the practice. Like I said before, there are multiple exams. There's a medical exam, a nutritional exam. The difference between our examination is that it is nutritional based and it is looking for signs of malnutrition and deficiencies. But for example, the Academy Director of Quality Management, Sherry McCauley, who is an MS, MBA, RDN, has also talked about how that performance indicators for demonstrating in NFP have been included in the scope of practice for an RD for over 10 years at least. So it definitely is in their scope of practice, and it's just something that's very underutilized. Once again, kind of similar to these other problems, it's the fear of the unknown. An example from a article I read was that Kim Jacobs, who's an RDN, explains that she did not get any practice or did not feel comfortable in learning the NFPE and was not ready for that when she came into her internship and learned that post-internship. So she was already kind of behind the 8 ball. And then recent surveys show that although 78% of RDs said they were familiar with the NFPE, they were only 27% of them had performed it. So it's a small amount. In addition, 1 in 4 residents from the survey said that they don't feel comfortable using the technique, and 38% of them don't have enough education or training toward doing a nutritional, functional, physical examination. And once again, the physical touch and assessment is just something that many RDs are not comfortable with. So in summary, a nutrition-focused physical examination assesses nutritional deficiencies by looking in signs and symptoms on the patient's body from head to toe, and noting that these deficiencies are either nutrient-based or non-nutrient-based. In addition, there is the help to better equip RDs with the information to correct deficiencies in malnourishment So these will help them kind of see the signs and make a plan for that. In addition, there's examinations also give help for proper care and maintain to improve in health of longevity of patients. So they're super important with RDs and trying to figure out what's wrong with the patient, helping them fix their malnourishment or deficiencies. Lastly, for us, we have some questions that are going to be answered by our other partners. So some of these questions would be, what are some ways in which RDs and or students can receive more information and training on nutrition-focused physical exams in order to better their didactic skills? What makes an NFPE crucial during puberty in pediatric patients? And how does a nutritional focused physical exam identify malnutrition? Thank you.